welcome to what has been something that's Sanjeev's been planning for the last few weeks, and he's already started several appeals. I think, Sanjeev, do you want to explain why you're doing this emergency appeal for medical supplies now and what you want to achieve from it?
Yeah, I mean, we registered, well, when I say we, a big group of people based in Trier who are Germans and Ukrainians set up an emergency charity appeal. And since about Thursday last week, have been driving medical supplies from Trier almost 24 hours a day back and forth via Poland to the Ukraine border to be distributed. I believe that they're in touch with the Ministry of Health, Orest, about getting the specific supplies. And then somebody at the Ukraine border is picking up the supplies and bringing it to your region. And just to say that, Orest, you're the medical director or chief surgeon in the Lviv region and appointed by the Ministry of Health. Is that right? Dr. Chemerys?
Yes, I'm the head of the Lviv Regional Healthcare Department. So it means that I'm responsible for the Lviv region.
Yes.
So yes, as you know, the place is the western part of Ukraine. It's near the Polish border. And nowadays, of course, first of all, we are focused on this war, and our department and all our region is focused to and try to do the best and to help to the hot places with all humanitarian assistance which nowadays come to Ukraine, because we are the western city, and our task is to help our colleagues who now in Kharkiv, who now in Lviv, so in all the cities where we have the active war.
Right. Okay, that's fantastic. And Jerome put me in touch with Thomas Crabtree literally in the last 24 hours when I asked about somebody with sort of global trauma experience, handling multiple trauma in the field. And Thomas, just very briefly, Thomas Crabtree is a plastic and recon surgeon and a retired colonel in the US Army with a myriad of military experience around the world. He worked in the UN hospital in Somalia, in Mosul, in West Africa during the Ebola crisis, and you've had many combat tours across the world and humanitarian missions across Africa and Asia. So, and you know, I myself trained in head and neck surgery in oncology and work with plastic surgeons for reconstruction, microvascular recon, so I understand. So I'm very pleased to have you here with your experience. And perhaps between Jerome and Thomas, we can speak to Orest about how trauma is actually managed. I mean, you know, in a multiple trauma, you've suddenly got an onslaught of multiple trauma happening. We wanted to understand what the training is, the organization is, the staff, how it's being handled at the moment, where you envisage it going in the next few weeks, in terms of, do you have enough supplies? What kind of supplies do you need? That's, you know, things like blood replacement products, fluid replacements. So all of these sort of things, very complex subject. We just wanted to get an idea. And so I'll sort of hand it over to Thomas to start off the questioning.
Thank you very much, and a real honor to meet everyone virtually here. But as I understand the purpose here, it's for us to better understand the situation you're faced with, Dr. Orest, and how we can best help based on that information. So if it's okay with the panel, I'll go ahead and ask a few questions, and I'll keep the questions very short and allow you to answer, and then ask again the next question. So I guess the first one, Dr. Orest, would be, are most of the hospitals that you're associated with or that you're familiar with and getting information about in Ukraine, are they able to handle the trauma cases that are coming their way right now? or is it just overwhelming? That's the first question. Over to you.
So now our hospitals are ready to accept such trauma patients. Of course, so our doctors had some experience. Of course, firstly, if we are talking about the military part and the soldiers, most of them are located in the military hospitals. But of course, first of all, and we focused on the people who has different type of injuries, multiple trauma after these exhibitions and after all actions are the which are caused by the war. Yes, so we have a lot of patients, yes, every day, especially in the hot places, who are admitted to the hospitals. So also we have, unfortunately, a lot of the hospitals suffer after this active war, yes, and they have the problems. They can have the problems with all the even communities, which help to make the hospital lives. So nowadays we treat all the patient, and of course, if it's possible, more some patients are transferred from this eastern and southern part of Ukraine, and mostly they move to the western part of Ukraine. When nowadays we have all possibilities to and the patient have possibility to receive all medical care they need. So that's why we organize our work in such case that firstly, if we have the severe patient, most of them located there, and another patient, if it's possible, of course, they move to the western part of Ukraine.
Thank you. Do you feel currently there are enough doctors, nurses, and beds to support your needs, or is there a shortage?
So if we are talking of, we have nowadays, we have enough doctors and nurses, but we also suspect if the war will continue, so we will have the most of the people can move to another territories, and maybe in some places we suspect that we will have the problems with doctors and nurses.
Understood. Thank you. As you mentioned, unfortunately, it appears that this may go on for quite a while. And as such, critical items will be in short supply. And of course, the healthcare workforce like yourself will become exhausted. So we all stand by to support. But could you mention specifically so that we can better help you and help your hospitals and by extension help the Ukrainian people? Can you give us an idea what supplies are starting to become in short supply? And I'm talking about IV fluids, antibiotics, anesthesia, material. Can you give us some detail there?
So of course, all these points which you have already stopped, it's antibiotics, the fluid for replacement, bandages. So everything what is necessary for trauma, for injuries, for emergency cases, especially emergency surgical case, and we need. So all this thing for trauma, for multiple trauma, and all these materials which is necessary in the first stages is very useful nowadays. And all humanitarian assistance which we receive, and we are very thankful to all the countries, European countries and other countries which support Ukraine, because we feel that almost all the world support Ukraine now. Yes, it's very useful, and all this assistance we're not focused on one place, we share with all regions where it's necessary. But all these things which you told, it's very necessary nowadays.
And how are you doing or managing your blood supply? Is it something you're able to provide on your own, or would it be of help to get additional blood supply?
So if you're talking about we need some blood supply, but I want also to inform that our Ukrainian people who can go and can be donors come to those places, and of course we do everything most of the people feel their responsibility, and mostly we don't have any problems with blood, but we also understand that the war is continuing and our resources can be less and lack.
Thank you. And you mentioned earlier that you're trying to move some of your patients out of the hospitals to more to the west. Are you able to evacuate patients as you need so that you can make room for more, or is that very difficult, or is it dependent on the location?
It depended on the location. So in some place it's not so difficult, but some places, of course, it can have some peculiarities. Depends on the region. It depends on the situation. But we try to do our the best, and also we try to get this patient to more safe places.
Of course, and at the point of injury, when people suffer from a mortar explosion or gunshot injury, is the system working to be able to get them from the point of injury to the hospital, or is that becoming more difficult?
So first of all, we try to get this patient and to get it to take them to the hospitals. Yes, the base position, but unfortunately, sometimes we have places that very difficult to take this patient. That's why our medical system works in such way that first of all, when we have such explosion or gunshot injuries, we try to get this patient and as soon as possible to get to the hospital, of course, to the nearest hospital, as you understand.
Exactly. A couple questions on the safety of yourself and your colleagues. The WHO reported today that there's at least 14 documented cases of hospitals being targeted and destroyed or damaged in a way, and of course people injured. Are you and your colleagues safe, or is this an increasing problem? It's obviously a very difficult problem.
It's a really problem because unfortunately I can't say that my colleagues which are on the places where in the hot places can feel safe. Unfortunately, it's really, you see, and you already notice that a lot of hospitals are damaged. Yes, so we have the cases when we have the damaged the cars, the ambulances can be after the gunshot. That's why it's really a problem, and unfortunately we are not safe. But all our doctors try to do the best, and everyone on their places, even when we have the active phase of war, they save their patients, of course.
Of course. I just have one more question, and I'll turn it back over to Sanjeev and Jerome. But as this goes on, of course, you'll need additional healthcare workers to support you, and I mean, you can't work 24 hours a day, every day. I think the world is situated or is ready to stand by and support that. Of course, supplies we have talked about. And of course, when we talk about doctors and nurses, and trauma, we don't forget that it's elderly and adults and women and children and even infants. So there's a need for specialty care. But any comments, do you think there'll be a need for field hospitals? Or do you think there'll be enough of the existing hospitals to support the need?
So nowadays, I think that maybe all the existing hospital can be enough nowadays. But if we are talking about the situation we have today, but of course, to make any prognosis is very difficult. And that's why as I know, some regions of our countries which are close to the places where we have the active and the hot places, I think maybe it will be need such the field hospitals. Of course, I can't answer that we don't need it. It's very too difficult, to be honest, to make any prognosis. It depends on how it will be continuing, of course. But on those places, when we have the hot places, I think they can be useful.
Of course, thank you. Great, very enlightening answer. Sanjeev, I'll turn it over to you
Yeah.
at this time.
Yeah, thanks very much. So Orest, I mean, it's a very rare opportunity to speak to a fellow medic who is in the middle of a war trauma situation. We get some reports in, through our newspapers, but can you give us have you got any sort of idea in terms of numbers of casualties that you've had so far and the demographics, like how many? Do you have an idea about how many children so far have died or have been injured?
So I don't know exactly. So there are a lot of children and women who are suffer. I don't know. I can't answer exactly which number of it it's today, because we have some information, but I can't answer for the whole country, as you understand, because I'm responsible firstly for my region.
Yeah.
And that's why. But unfortunately, yes, we have cases every day. We have the cases when children died, yes.
Yeah.
When we have the cases when they killed. We have the cases when they suffered, women and families, adult persons. So if we have the case when they suffer the whole town, cities, of course, it's very sad statistic, but we have it's true.
So following on from there, do you have enough pediatric resources to in the hospitals that are affected and personnel with specialized pediatric?
So of course, and understand. So if the adult can be treated on these hot places, yes, but when we have the children, of course, the ministry try as soon as possible evacuate them from the hot place, and also to evacuate the children from the cities where we see that it can be the risk for the children. That's why, as much as possible, we try to move them to the more safe cities. As you understand, children is priority.
Absolutely, yeah. In trauma management, radiology is a essential service. Getting urgent radiology, CTs, ultrasound, MRI. Are your hospitals fully equipped with these services in the affected areas?
To be honest, so of course we need some X-rays. Yes, it's more. So of course, if you're talking about the trauma, it's first of all a CT scanner. Not all hospitals has it, but the biggest hospital, of course, has such a CT scanner. But we also think that maybe the portative, yes, the mobile X-rays and sonography can be useful, and we need it more, of course, because especially this such mobile things which can move from one hospital to another hospital, and even, of course, if it will be necessary, we can use it even in the field hospital. That's all. It's all this equipment which can be used and can be moved. It's unfortunately we have the lack of it, of course.
That's right. In the UK, we use an American-based trauma management system, advanced trauma and life support, where we have multiple team members who know exactly how to manage trauma, particularly multiple trauma at the same time, sort of the airways, the breathing, the circulation, going through these sort of steps, and then a secondary survey. Do you have ATLS or something similar where, I mean, before the war, are your emergency services trained in specific trauma management?
Yes, of course. Our emergency hospital, we have every oblast, yes, have such emergency hospital where all patients with multiple trauma admitted. That's why, of course, we have the experience, and we have the same systems which you named, and we tried to work. We not tried, we worked according to this rule. That's why, of course, we have such experience. But if we are talking about the war, when the patient who with multiple trauma and gunshot trauma and explode trauma admitted to whole hospital, not only those basic and huge emergency hospital, but even about the small hospital. Of course, those hospitals unfortunately doesn't have such experience. That's why we try to, mostly in cases when we have a lot of this trauma patient, to focus them on this big hospital where the doctor have the experience to manage this trauma.
It's a lot more centralized services.
At the weekend on Saturday, Henry Marsh and David Knott, who are two British doctors. David Knott is a war surgeon, Thomas and Jerome and Awali, but they did a 12-hour training program on war injuries. Now, it does seem, given the fact that we've got Zoom, we've got experts as amazing as Jerome. Roman Clegg I'd like to bring in now, because Roman's head of the Ukrainian Medical Association in the UK, and he's a consultant anaesthetist and pain expert. But I thought you just needed to hear from Roman about what Roman's doing to help all of you. So Roman, would you like to join us now?
Hi guys, thank you for inviting me, and it's a pleasure to be in such an august company of specialists, and greetings Orest in particular, and thank you for inviting me again. Well, the Ukrainian Medical Association, in collaboration with the British Ukrainian Aid and a few doctors groups, On Call Room, one of them, is a collaborative that we basically just centralized and assist with the supply, collecting donations and fundraising for from military medicine or medicine in general, for the benefit of Ukrainian frontline doctors, and to assist them with equipment and medications and first aid kit.
So do you two know each other? Have you come across each other before?
No, I come from the same city, but I haven't had a pleasure of meeting Orest before.
I think what would be really good is to find out really what Orest needs, because he obviously needs aid, but does he need link-ups from experts like you and Jerome and Thomas and Awali to really help him deal with the problems they're going to face, and how that could be done? Is Zoom a way of helping you, Orest? You know, do you want to be able to log in and have a ward round with doctors outside for support?
Of course, this first of all, our doctors need some experience. Of course, I think it will be useful if we will connect to them and we will work with all doctors and the who can share their experience. It will be, of course, very useful, and we will be ready to contact to them. And if it's possible, we can organize the surgery, the surgeons and all who are responsible for trauma, and trauma surgeons, trauma orthopedics, neurosurgeon who can be present at the Zooms, of course.
Yeah, I mean, that's a great idea. We could definitely coordinate that if you speak to your colleagues, and we can get experts to have a weekly Zoom session. But the main thing is, we've set up a charity, and medical supplies are going from Trier, Germany to the border day and night. And I just wanted to get a handle of the specifics that you need, particularly the trauma stuff, because I think things like blood products are very difficult in terms of regulation to get out of our country or Germany to your country. So actually, if you had some sort of data in the coming weeks of where you think you may get stuck, or where you can spot a deficiency in advance, and let us know, then we can put that forward, and I'm both in Germany and with Roman's help in the UK, and maybe try and get it to you through the proper channels.
Orest, I have a question, if I may, if panel
Yes.
will allow. We previous shipment that was sort of spot requested by, I think, your hospital was delivered by Dennis Ugran and Oksana, his wife. It was indeed delivered via the Green Corridor in Peremyshl. Now, with variety of more trucks going to Poland from the UK, is my understanding correct that we're delivering everything to Helm Airport cargo facility? And is it correct to that our understanding is that then the shipment is moved to Lviv military hospital for distribution around the sites in Ukraine? Can you describe the logistics to the best of your knowledge from Helm, if you know, into Ukraine, and how does it reach Kiev?
So first of all, there are two logistic ways. So if we are talking so our medical system consists of two parts. Yes, it's a military medicine. Yes, it's has his it's which was regulated by the Ministry of the Military Ministry, and now we have the civic medicine. Yes, so all tracks as usually come to Lviv, then they located in Lviv, and all after Lviv it shares to another region. So first of all, we are focused that if Lviv is more safe city nowadays, of course, firstly it comes there, and then in connection with the Ministry of Healthcare, and depends on the request from another region, it moves to another region. So it doesn't stay in Lviv, because it just first center where it comes, and then it moves to another region. So we don't keep anything here, because we have the regions which need it more than we nowadays.
And what sort of time frame are we looking at from the delivery to Lviv hospital to Kiev? Because obviously the logistics routes are challenged. Are you using predominantly civilian or military sort of logistics solutions to grab?
So if this humanitarian system come to the civic hospitals, of course we use the civic tracks or trains. It depends on the city where it needs. But if you are talking the military system, unfortunately, you understand I don't have exactly information. That's why they also share in their hospital. But I'm responsible for the civic system. That's why I can tell you, you can be sure that all this humanitarian system come to the place. We have the logistic ways. We know how to get this and to take these humanitarian systems to all cities.
Okay, thank you.
That's great. Jerome, have you got any questions for Orest?
Thanks, Sanjeev. So Tom asked one of my questions about needing field hospitals, but the second one is, I've seen or read, I think many of us have read reports of large numbers of internally displaced people, refugees who are heading west. Is there a need for medical care in the areas where they are congregating before they cross over the border? So is there a need for, again, field hospitals or other medical services to internally displace people? Because as we're looking at large numbers of people in a single place and not being allowed to cross because the borders apparently were open, but there's been some attempt to shut them down by the opposing forces. Is there a need for healthcare services in those areas, or is your ministry already taking care of that?
So of course we organize the medical care in the places when you have a lot of people, especially maybe you saw that during those almost 2 weeks we have a lot of people on our borders who try to move to another countries. Yes, and sometimes it takes even 2 or 3 days, and also we organize such the medical care on the railway stations, because we have a lot of trains which move from the eastern part to the western part. That's why we organize such assistance, and those things is useful. That's why if you're talking about the field hospitals, I think if the war will continue, of course we will need it. Of course we will need it, because we will need the support for all the people who move from another towns. Because, for example, we have the cases, for example, some cities in western part of Ukraine, I'm talking about the oblast cities, the biggest, they receive a lot of people. So that's why, of course, we will need it, because those people can, you understand, can get sick, and another thing. That's why it can be, of course, it can be. We suspect that it will be. We will need it.
Thanks.
Sanjeev, this is Tom. Could I ask Orest one more
Yes,
question?
of course.
So Orest, we didn't, when we were talking about supplies, we didn't talk about a very essential supply because it's so difficult to operate in the dark. We've heard issues about electricity, about diesel fuel for generators. Has that been a problem? So number one question is electricity, and number two is oxygen supplies, because that can become a real problem as well. Comments on those two?
So of course we suspect and prepare the generators we should have, and we try to do the best and prepare the hospitals, because as experience shows on this hot place, we had the hospital, unfortunately, who worked without electricity. That's why the generators, it's very useful, and we are looking for it, to be honest. And even when we prepare our list, what we need, we wrote about this thing, because we understand if we'll have the war in different cities, mostly first suffer the hospital. The biggest problem is this electricity can be, because we should need it. It's very important.
Thank you.
Well, thanks very much. I think that we can wrap this up, and maybe we could, Orest, maybe meet again in a few weeks' time. And if there was anything that you want to discuss with your colleagues in the more eastern areas, if there was anything that you wanted to sort of hook up with our doctors in America or the UK, we could organize that. And also for the audience that's watching, our charity will be on our website. It's the Humanitarian Assistance TRIA. It's a German registered charity that's been running for the last week. So, and I believe they're in touch with you, Orest, as well.
I want to quote the very famous person who comes from Lviv. His name is Shalom Aleichem. Are you familiar with his writing?
I am familiar with him.
Fantastic. And I would like to quote him, no matter how bad things get, you got to go on living, even if it kills you. I think Lviv is proud of many, many citizens. Shalom Aleichem is one of them.
Yes, yes, it's true. Thanks.
Very good. Thank you.
Thank you, Roman.
We're so proud of what you've done, and Sanjeev, thank you for organizing. So we need to do things in this way, even if it's just a closed shop with Orest, your doctors, and with us, with the help of all these amazing people around us for advice. And you need some kind of continuity and also moral support.
Yeah.
So, you tell us what you want morally, because it's difficult to get things over from particularly where Thomas is in America and where Jerome is, are you in South Korea or Stockholm at the moment, Jerome?
South Korea.
South Korea. Okay. Well, listen, thank you all for joining us. Sanjeev, thank you for doing this part of the webinar. I'm so pleased to have heard the words of Shalom Aleichem. Really, Sanjeev, there's nothing more to say, is there? So listen, Thomas, it's great to meet you. Orest, my thought is with you all the time. I think the whole world's with you at the moment. And as doctors, it's such a tricky one, but I think the important thing is you might need this degree of what we call balance listening to, people being there, and Roman can organize doctors who speak Ukrainian, which is pretty important as well, because he knows them all. There's a liver specialist who's listening tonight from Glasgow who's on mute, and I'm sure he'd have liked to have said something. And thank you all for joining us tonight, and we will do something very soon.